Namaste. A very warm good morning, good afternoon, wherever you are. I'm Dr. Rakesh Ghimire, currently working at Tribhuvan University Teaching Hospital. Today, I'm here to give short lightning presentation on the findings from my research topic, high drug resistance to PAPs in sputum samples from an intensive care unit in Nepal. PAPs stands for Pseudomonas, Acinetobacter, Burkholderia, and Stenotrophomonas. The problem with this organism is critically ill patients admitted to intensive care units are highly vulnerable to infections caused by these organisms due to repetitive invasive procedure such as endotracheal intubation. What we did was, among the ICU admitted patients in Tribhuvan University Teaching Hospital undergoing sputum cultures to determine the prevalence of these organisms and their antibiotic resistance. Data was collected by reviewing the hospital laboratory and ICU medical records of 67 patients with only PAPS infection between April 2018 to April 2019. Then what we found was, among 104 positive bacterial isolates, 64% were positive for PAPs, which means high prevalence of these organisms. Pseudomonas accounted for 31% and was the most common one. When we looked at the resistance to at least one antibiotic, which was 97% among Acinetobacter, we also found the missing data from the medical records. This poses a problem because PAPs are important nosocomial pathogens with the ability to grow in any adverse conditions, resulting in high risks of infection. The high prevalence of PAPs in hospital-acquired infection and its resistance to antibiotics results in increased risk of morbidity and mortality of the patient. The incomplete patient-specific data from the medical records limits further exploration of trends of antibiotic resistance and possible associated risk factors. Based on the findings of this study and its implications, my main recommendations are: Infection Prevention and Control Committee should monitor the source of infection and strengthen its infection prevention control measures. Drug and Therapeutic Committee should educate staff on the rational antibiotic use, resistance, and optimal prescribing, and continue to monitor and report on antibiotic use and resistance. Our next recommendations are: Medical Record Department should reinforce an electronic medical record system. Since Hospital Management Committee is superior to all other committees within a hospital, they should bring together and support Infection Prevention Control Committee, Drug and Therapeutic Committee, and Medical Record Department in accomplishing the previous recommendations. PAPs are found everywhere in the environment. Pseudomonas can survive even in soap and water, meaning high risks of spread. With this, the final take-home message is high prevalence of PAPs in sputum shows high antibiotic resistance. Let's work together to stop this. Thank you very much for your kind attention. Any questions are warmly welcome. You can reach me in the following contact details if you need further information, or you can refer to my article below for more details. Namaste. Have a good day.